and get started, as we do, I'd like to welcome everybody here tonight. My name is Tom Sager. I'm the past president of the United Way of Steele County, and most recently was helping with the United Way on this important initiative of their strategic plan. And we'll talk a little bit more about that in a bit. But before we go on and get into the details of the evening, we just wanted to honor and acknowledge and thank you for being here. We know that every one of you is very busy, and on a beautiful, almost spring evening, there's probably a lot of other things that we could be outside doing. But you're here, and your physical presence matters, and the input that you'll be providing this process is very valuable too, and we thank you and honor that. That said, a little bit about tonight. This is really the culminating event of a strategic planning initiative that started with the United Way back in about December 2012. And the way it worked was this. The United Way applied for a grant to the Bremer Foundation. And what we wanted to do as a United Way of Steele County and as a community was to identify disparities in our community in 3 specific areas. Those areas were in income, education, and health. So we applied for a grant to Bremer. Evelyn, our staff, did that. Right? Were you checking my feedback? Thank you. And it was secured. With those funds, we were able to go into the community with the help of Rainbow Research and Barry Cohen and his colleagues and ask a lot of people a lot of questions in a lot of different formats about their experiences, their real life stories of finding disparities in income, education, and health. And the goal of that was to not just find out where these disparities may be, but secondly, and almost as importantly, as to find out what are those obstacles and barriers. That was really part 2. And then part 3, once we identified the disparities and the obstacles and barriers, then we are going to, and that's what this evening is a big part about, is to ask ourselves as a community to look in the mirror and say, okay, what are we going to do about that? And to identify all the resources within our community, because we do have many, and leverage those resources to help addressing some of these disparities that we do see, that do exist, and the obstacles that create them for all of us. Okay? So that's really what tonight is about, is gathering some further input and then going through a process that Barry Cohen and his colleagues are going to lead with us to really secure your thoughts, your opinions, your experiences on where we as a community should take this in the future. Kind of overseeing this process for the United Way is David Berg. David is our Vice President of Strategic Planning, and he'll have some closing comments at the end. But David is really the one now that's taking this initiative with us and bringing it into fruition with the United Way and really for the next 12 to 16 months. So with that, I'll stop talking, turn it over to Barry Cohen, and let's give Barry a nice warm welcome.
Well, welcome everybody, and I'm delighted to see an audience of this size. It speaks well to your community that so many of you are interested in this process. It's been really gratifying to my colleagues and I over this last year to have had an opportunity to meet with so many of you in the community and listen to your concerns and issues. And Garth will shortly be talking about the process that we used. So we look forward to sharing with you tonight a small portion of what we've learned over the course of this year, and a full report will be forthcoming that will be available to all of you. It will go online and there'll be paper copies available. I'd like to introduce my colleagues. Kate Bosserman, a research assistant with us, and Garth Osborne, research associate. Thank you both for your assistance in all this. You can stay. Let me ask first, does everybody have a copy of 2 handouts? These will be very important, and Garth will be explaining shortly what it is that we'll be asking you to do. But what we looked at is disparities in income, health, and education, as Tom just explained. And what we'll be giving you is an opportunity to discuss these topic areas. What we'll do is each of us will start with a 10-minute presentation. After that presentation on a disparity area, we'll invite you to spend 15 minutes discussing that issue. We have a facilitator at your table. Facilitators, could you please raise your hands? So there's one facilitator at your table who'll help keep the conversation moving. They're not there to express their opinions, but to seek yours. And then after the conversation, we'll give you an opportunity to vote. You'll get 2 sticky dots. You'll have an opportunity to say, these are the 2 most important issues or barriers that are of concern to me, based on what I've heard in the discussion and in the presentation. There may be issues that you don't see on our list, that you don't see on that document that you have in front of you, that you think are important concerns for this community. You're free to bring those up as well. Don't restrict yourself to what's there. And after each round, as I said, we will do this kind of voting procedure. And at the end of the meeting, we'll tally things up and we'll let you know what are the 3 issues that surfaced as most important in each of your groups. So again, thanks everybody for joining us. We look forward to hearing what you have to say. And when we complete our final report, the findings from this meeting will be included in that as well. So with that, I turn it over to Garth, who will lay out to you how it is that we gathered the different information that we did, who we spoke to, and what kinds of methods we used to gather that information. Thank you, Garth.
Thanks. Thanks, Barry, and good evening. It's nice to be back in Steele County. I'm going to talk a little, as Barry said, I'm going to talk a little bit about the methodology, which is just basically a big word explaining what information we collected and how we collected it. And looking basically at disparities, we're trying to collect a lot of information from a lot of different sources in a lot of different ways. We collected, over 700 people participated at some point in this data collection process over the last year. And the reason we're doing that is because oftentimes disparities by their very nature, especially in communities that are doing well, generally doing well, the disparities usually surface in the people that tend to be sometimes the most isolated and hard to reach and recognize. And plus, it's also an opportunity for us to hear from different parts of the community and hear if we're hearing the same stories from different parts of the community. A little bit too, because of the time limits, a lot of the information that we're giving here is kind of just really kind of an overview, and a more detailed report will be available in a month or so. We use several data collection methods, and the first one we always start with is basically a literature search, which is looking at census reports, government reports, studies that have been done, things like that. The next thing we did was we talked to service providers. These are the people that are out in the community working on a day-to-day basis with the people who are experiencing the disparities. These are religious leaders. They are people working in social service organizations, healthcare providers, academic educators, people like that. We had 6 meetings with 30 people at those. And then the next group were community focus groups. And there we tried to meet with the people who were actually experiencing the challenges that we're talking about tonight. A total of 13 focus groups were held with a total of 106 participants. 3 were done in the Somali language, 3 were done in Spanish, and 4 were done in English, to make sure that we got a broad perspective. And then we talked to the United Way Strategic Planning Committee. We also did an employee survey that people might have participated in here and got a response of 480, which is quite impressive. And then about a month and a half, no, actually it's been 2 months, I think, we held a CEO roundtable that was attended by 27 business leaders from Steele County. And then tonight's town meeting, as Tom said, is kind of our last culminating step in the data collection process. So that's kind of it. That's the data collection. Next, I want to talk about what we've collected in terms of poverty and income. While the average household income in Steele County is $57,000, which is higher than most of Minnesota and the U.S., there are still some pockets of poverty in Steele County. And from our research, we identified 7 different disparity areas. Limited number of living wage jobs, lack of employee benefits, limited access. People, this is also in the handouts. What we did was, for tonight's presentation, is to kind of break it down into 3 theme areas. The first one, looking at changes in the job market and who is affected. The second one, looking at what the cost of basic necessities and who is lacking in them. And then the third is looking at immigrant legal status, because a lot of the issues that we're seeing in the mainstream community are also mirrored even more so in the immigrant community. Some of the same challenges faced. Really, when we're looking at employment and income, we're looking at kind of 2 broad groups, it looks like, in Steele County. The first being the unemployed, and the second being kind of the underemployed. And by the unemployed, let's see, 5.1%, and this is just from January actually, is the unemployment rate for Steele County, which again is lower than the rest of the state of Minnesota and also the nation. And most commonly, the unemployed include disabled, physically or mentally unable to work, people just starting to enter the workforce, like just out of school and looking for jobs, and then people that are still trying to get employed after the recent recession. And the majority of the people in this area, in this kind of group, the unemployed, are able to access public assistance programs. In contrast, there's also a population of working poor, which there's not really a number for that per se, but if you kind of look at it in terms of if the unemployment rate is 5% and 9% of the population is living in poverty, there are at least 4% of people who are living poor and working. And generally, the most common include single-parent households, immigrants and refugees, and other peoples of color. And kind of the descriptors that we identified were people holding down multiple jobs, most of the time temporary jobs, part-time, minimal benefits. Several are raising a family, kind of living paycheck to paycheck. If something goes wrong, it's trying to get caught up. And then also priced out of making enough money not to be able to qualify for a lot of public assistance programs. So that was kind of the income side. The expense side, this comes from the Jobs Now Coalition, which does estimates of the monthly costs of living for different counties in Minnesota. And if you'll, the parentheses numbers are the rankings. This is for a single parent, 2 children family. This is for a 2-parent, 2-children family. And if you'll notice, the same 3 costs, housing, childcare, and transportation, are consistent. Their relative ranking changes a little bit, but they're all 3 pretty high. Let me look at some of those specifically. Steele County has 14,000 housing units. About 3/4 of those are owner-occupied houses, and about 1/4 of them are rental properties. About half of the households living in the rental properties are paying at least 30% or more of their monthly income toward housing. 30% of your monthly income is going towards housing, which is another measure of poverty. And if you run the numbers, it comes out to about 1,750 households, or roughly 13% of households overall. So these are the top two bullets are talking about people living in housing, but then there's also an experience of homelessness too. And this includes people doing what they call couch surfing, having to move around between different relatives and friends, or living in homeless shelters. And this is kind of come down equivalent with the working poor a lot of times. The other big expense is childcare, and Barry's going to talk more about this under education, but as I noted in the previous slide, it's averaging about $700 per month, but that can really span a large range from anywhere from about $5,000 for a preschool family-based childcare, so like a kid just before they enter grade school, at about $5,000 a month, $5,000 a year, up to $10,000 a year for an infant and a licensed child daycare center. So we're talking about a fairly significant expense. And where this comes down in terms of disparities, and this comes from Steele County's Human Services, is who oversees about 200 daycare homes in Steele County. The groups that are kind of falling through the cracks are people that are trying to work second and third shifts, that they don't have access to the child care during that time. And then also communities from various racial and ethnic groups that don't have as many people that have services available. And then the next area is transportation, and this is kind of the cross-cutting one, because this not only affects income and your ability to earn a living, but then also obviously access to education services, healthcare, just general civic engagement. 90% of Steele County employees depend on private vehicles to get to work. That's probably something that everybody here knows. I'm not surprising anybody. And the average family of four spends about $800 per month. As immigration legal status, Steele County, as we know, is still very predominantly a white community compared to Minnesota and the country, but it's changing over time. Roughly 7% from the last census for Hispanic, and about 1% sub-Saharan African refugees. And one of the things we heard repeatedly from the communities of color and the professionals who are working with them is that together, immigration, legal status, language, and cultural differences add to the challenges that we have listed here across each of these three areas: health, education, and income. And the other message that we heard back was that immigrants and refugees feel safe here and appreciate the opportunities that their children have to succeed. So that's a lot of stuff. Let's go to the question. What are the most important income disparities for our community to address? This is what we would like to turn back to you and the facilitators at your table.
I'd like to introduce my colleague, Kate Bosserman. She'll be dealing with health.
Hi. Overall, Steele County is very healthy. So you guys can all give yourselves a pat on the back for that. It's ranked by County Health Rankings and Roadmaps as the second healthiest county in the state, with only 5% of residents reporting fair or poor health. However, there are disparities in who experiences good health and poor health by income and race ethnicity. So in the United Way survey that Garth mentioned, we found that people in low-income families are less likely to have health insurance and less likely to regularly eat fruits and vegetables, but they're more likely to experience frequent anxiety and depression compared to people in higher income families. So that's just one illustration of health disparities that your community is facing. The health disparities that are listed in your handout fall really under three themes. First is obesity and chronic disease, which covers health problems that stem from obesity, such as chronic health issues like diabetes and high blood pressure, and then some of the causes or the issues that cause obesity, like poor nutrition and lack of physical activity. The second theme that we're going to cover is healthcare systems, which includes access to healthcare services for everyone, regardless of income, cultural background, language, etc. The third issue that has come up as a concern for your community is common mental health issues, as well as access to the support and treatment for those issues. So I'm going to start to cover obesity a little bit more. So as you can see from the statistics, obesity is a childhood and an adult issue that affects all demographic groups in Steele County, regardless of race, income, age, etc. 30% of adults in Steele County are obese, a percent that's been rising in recent years, and it's 4% higher than the rate of obesity statewide. Some of the consequences of overweight and obesity include type 2 diabetes, hypertension, heart disease, and other serious health problems. The rates aren't that much higher than other places in the state, but it's still a major contributor to ill health. Some of the causes of obesity include lack of healthy foods. So for many low-income people living in Steele County and around the state, poor nutrition is a result of the cost and availability of healthy foods like fresh fruits and vegetables. Some of the barriers that we heard to healthy eating from your community are the cost, obviously, of fresh fruits and vegetables, limited fresh foods at the food shelf. The farmers market doesn't accept EBT cards, and then if people are undocumented workers, they're not eligible for EBT or other government food assistance. For other people, the barriers to eating healthy really have to do with the time that it takes to prepare a healthy meal. Many employed people say that they are just simply too tired at the end of a long day of work to prepare food for their families, and it's easy to resort to fast food. About half of the restaurants in Steele County are actually fast food chains. So as you see from the statistics, kids and adults just aren't eating fruits and vegetables. So although it's a problem across the board, there's still an income disparity. Among respondents to the Steele County survey, 70% of people with an income of $100,000 or more reported eating green vegetables on 5 days in the past week, compared to only 29% of people with an annual household income of $25,000 or less. So there's a huge gap in how much people are eating fresh foods by income. The next slide is about lack of physical activity, which is another contributor to obesity. Only 22% of adults in Steele County, or actually 22% of adults in Steele County report no recreation time physical activity, and only 72% of people felt like they didn't exercise enough in the Steele County survey. Kids and teens aren't doing that much better. Only 40% of 12th graders report getting the recommended amount of physical activity every week. So why don't people exercise? The barriers that were given in the Steele County survey included lack of time, lack of energy, and lack of motivation. Lack of facilities was also mentioned in focus groups that we did with community. There's just simply barriers to having a place indoors to work out when you have lovely weather like this. I'm going to move on to healthcare systems. So when I talk about healthcare systems, I'm talking about people having access to receiving preventative healthcare and to receiving just healthcare in general. So 9% of Steele County residents under the age of 65 are uninsured, and 12% of residents reported that they could not see a doctor in the past year due to cost. So lack of health insurance and underinsurance limit people's access to preventative care and from getting medications and treatments that they need to stay healthy. I'm also going to touch on the lack of access to culturally appropriate care. There are 7% of residents in Steele County that speak a language other than English in their home. So in addition to the difficulty of finding a provider that accepts everyone's insurance, many Steele County residents can't find a culturally appropriate healthcare provider, which means somebody who speaks their language and are knowledgeable about their culture. Next are mental health issues. So social service and mental health professionals, as well as educators and other community members, mentioned mental health issues as a growing concern. People in Steele County, like others around Minnesota, are dealing with high stress levels, depression, feelings of isolation. And while some people are receiving treatment for these issues, other people don't know where to turn to for help. For many communities, including Somali and Latino communities, discussing mental health problems is considered taboo and might interfere with seeking help or care. This ties back to the importance of providing culturally appropriate care in the community. And then in addition, many people also struggle with dual diagnoses, which is mental health problems in conjunction with substance abuse. So one of the things that people are concerned about is just not having anywhere to go to for mental health help and not knowing how to ask for that help. So to summarize, the health issues that were indicated by the United Way survey, focus groups, interviews with health professionals, and then other statistical data are issues related to obesity, including poor nutrition, lack of physical activity, and subsequent chronic disease. Issues related to healthcare systems, including lack of insurance and underinsurance, difficulty finding providers, and then lack of culturally appropriate care, and issues related to mental health issues, including the difficulty of seeking care for those. So I'm gonna turn it over to your table captains.
So we are now going to discuss a third set of issues and disparities, and these are around education. And I'll be the one leading the presentation on this. And again, we had quite a number of educational disparities that seem to group thematically into three areas. The first area that I'll be talking about deals with disparities in educational opportunities and access. Limited access to early childhood education, access to out-of-school time programs, disparities in college enrollment by income and race, and immigration in college enrollment. That one, if it doesn't immediately click, if you are not a documented resident of the community, if you're not a documented person, you can't receive college aid and assistance, and it closes you out. The second broad category are factors contributing to the educational disparities, and we see gaps in academic performance associated with poverty, gaps in academic performance associated, and I'm not saying caused by, I'm saying associated with race and ethnicity, the issue of racial and ethnic composition of our school staffs, and access to mental health services, particularly for children. And then the third set of issues deal with educational disparities in parental engagement in their children's learning, barriers to parent involvement in their children's education, perceived disparities in how schools respond to parental concerns, and lack of transportation to engage in conferences and other school activities. Again, a lot of data to cover. But let me begin then. Some of you may have been listening to Minnesota Public Radio this morning and may have heard that Minnesota ranks third in terms of the most expensive child care costs in the United States. Third rank, very high here. Garth pointed out, for example, earlier that licensed child care here in Steele County, the costs are prohibitively high. Infant care, center-based infant care, $10,000 a year, almost the cost of college tuition. Family-based infant care, $6,000. Center-based toddler care, $8,600. But irrespective of cost, yet a barrier experienced by some of your Somali neighbors has to do with so many of the private programs being Christian-based and not appropriate for parents who are practicing Muslims. Access to programs is a problem also for those who lack transportation and have to pick up and drop off children. If you don't have a private car, you are out of luck. And many people in poverty here in your community aren't even aware of what early childhood programs are available to them. And if they're at all transient, they never see or receive information about available opportunities. So, other disparities, limited access to out-of-school time programs. Out-of-school time programs can play an important role in education and in youth development. Most importantly to parents is that it keeps children safe and out of trouble, but they also promote and support positive academic and social outcomes. They teach positive and respectful behavior between peers, and they expose children to enrichment activities that encourage learning. But not all children in Owatonna have equal opportunity to benefit from all that you have to offer here. Barriers to currently available out-of-school time activities and programs organized by the public library, churches, and community organizations include the direct and indirect cost of participation, which can make activities unaffordable for some families. Think, for example, the cost of belonging to various kinds of sports leagues and teams where there are hikes, things like hockey, for example. You guys know what a pair of goalie pads cost. Very expensive. If you don't have the resource, you're not able to participate. Lack of transportation is also a large issue and barrier. There are also cultural differences. For example, a Somali tutoring program involving prayer sessions can't be held in a school setting. And then there's time limitations. So we heard that many Latino youth need to work to help support their families and cannot take the time to participate in what the community has to offer. Gaps in academic performance by race and poverty. The good news is, in Owatonna in 2013, there were gaps between the proportion of all students who meet or exceed Minnesota's annual measurable objectives and the proportion of low-income students and non-white students who don't. For example, 70.7% of all Owatonna students met or exceeded annual yearly progress in math proficiency. However, 75.8%, 83.5% of Asian students met or exceeded the math standards versus 49% of black students and about 57% of students on free and reduced price lunch programs. And those are children who live in households with incomes of 185% or less of the federally defined poverty line. We also see disparities in graduation rates by race and income, so that 86.8% of whites graduating from high school in 4 years here in Owatonna is very close to the state average of 88.2%, which ranks Minnesota fourth highest in high school graduation rates in the United States. But the Hispanic graduation rate of 65% here in your community rates very close to Mississippi's 63.8%, which is the lowest graduation rate in the United States. So we have this disparity, one group near the highest in the state, and in a state that's almost the highest in the nation, versus one group that's close to the lowest in the nation. And then finally, parental engagement. Parent-teacher conferences are really very important. How many academics and teachers in the room? Any? One, two, sometime teacher? Okay. Parent-teacher conferences are important opportunities for parents to hear about challenges, academic or otherwise, facing their children, and it's also an opportunity for parents to tell teachers about anything at home that might be affecting the student's performance or behavior. And here in Owatonna, you should be proud that your conference participation is very high. But some low-income parents and parents of color miss conferences because they don't see or receive a notice, don't understand English without an interpreter, don't have access or only have limited access to a computer where they might find online announcements, don't have the transportation to get to and from these kinds of things, or have scheduling conflicts with work and with church or other religious obligations. Parents also face other barriers for involvement in their children's education. We heard from Somali parents that because they don't have familiarity with the technical academic subjects such as math, limit their ability to help their children with their homework. So it's often an older sibling that has to help the younger ones. So these are some of the things we heard. This is some of the data that we have on education. And I invite you, because there's so much, when the final report comes out, it will be online. We will be able to make paper copies available through United Way if you're interested. But I think you'll find it interesting and useful. So with that, I'd like you to turn your attention to a conversation about educational issues. Don't limit yourself to anything I discussed. You don't have to limit yourself to the list. Thanks for coming this evening, everybody, and I appreciate the energy and thought that you've given to the conversation this evening. We will summarize it. We will integrate it with the other data that we've pulled together, and it will be in our final report. So, David, are you ready?
Yep,
Thank you.
Thank you. Yeah, very good. Thanks, Barry. Well, thank you very much. My name is David Berg. I work for Mayo Clinic Health System. I'm a recovering healthcare administrator. And, I want to explain that a little bit. I was a United Way aficionado several years ago. I got involved in the campaign. I got involved in our workplace. I got involved in the executive committee. And then I stepped back for a number of years. And so I had time, got all the kids off to whatever they were going to do. And I called Evelina and I said, hey, what can I do? I want to get back involved again. And she said, well, we're doing some planning. Would you like to help with that? And so I got to set through some focus groups. And what I found out in those focus groups was I didn't know what was going on in the community I thought I was serving through the healthcare delivery system. It really gave me insights. And so you asked what I learned, and what I learned tonight as I listened at my table and listened to other tables talking is that we broadened our perspective tonight. We learned things we didn't know from other people we didn't know about our very own community. Things that maybe were invisible to us before we got here tonight. And now we are United Way volunteers, if you will. We're invested in this. And so now we need to move it forward. And so that's the work we do from here. So let me just say a couple of things, and I'll be quick. Tom Sager is here somewhere, right? No, Tom went to he's off taking care of our education. Tom has been a terrific leader to the strategic planning effort. And I came to the strategic planning effort late. And it's really important to me to tell you that although I'm going to be in a leadership role this next year with regard to that, the people that led our committees, the people on our strategic group, did the hard work. And so when I look around out here and I see people like Dave Albrecht and Tom Sager and Mr. Coleman and I'm forgetting somebody now. Who's our other chair? Mark Krug. They did such hard work in pulling this together, and I really admire that work. So thank you to you guys. I also want to, absolutely. Really, really outstanding work. And so to learn from them has just been amazing. And I want you to recognize that your United Way is different. Okay? We used to think about United Way as a workplace campaign to raise money to help fund United Way agencies that were demonstrating need through good grant application. Well, they've taken a major leap forward. And the leadership of your board of directors and of Evelina and her team has taken the United Way to a different place so that they can have dialogue, organized, thoughtful dialogue around what's going on in our community, and we can begin to talk about what the initiative should be and help with that. So, the development of the team in the United Way, Evelina, it's been amazing. It's so good to see how far you've come. So, awesome. Now, we want to share with you an overview of our results, and so I asked for some expertise, and so Garth is going to tell us how we did.
Thank you. Yes, we've been in the back room smoking cigars and tallying results. I'll go through each of the three areas and list the the top 3 ranking ones. There were some ties. For income, the first one was the first one, the limited number of living wage jobs. Okay? Coming in second was lack of affordable, low-cost housing. And then coming in third was lack of child care. And we'll present all this back. For health, there was a tie for first between mental health issues and lack of physical activity. Second was obesity. And third was lack of access to healthy foods. Education was even a little bit more complicated. There was a tie for first between gaps in academic performance associated with poverty and barriers to parent involvement in their children's education. So that was tied for first. For second was limited access to early childhood education. And then again, there was a tie for third. Limited access to out-of-school time programs and gaps in academic performance associated with race and ethnicity. These results have been certified by Ernst & Young.
Excellent. And again, we'll share these with you. Now, our next step is to have Rainbow take a look at our results, take a look at our survey, and then they'll be feeding some information back to our income, health, and diversity group, our income, health, and education group. And then they'll work on it and have recommendations to our board of directors at their April meeting for priority and to begin action planning. Tom Sager would say, strategic planning is fun, but it doesn't get it done, okay? We have to do something with it. We have to take some action. So you coming here and signing that form, you're agreeing to help us take action. So that was part of our master plan, and we're going to count on you for that. So that's our next step. Count on hearing a lot about that. Now think about the day, and there's no accidents. Think about the morning and the travel you had as you went off to work or whatever you started your day with. It was kind of a rotten Minnesota winter day. It was slippery. It was a tough start. And then you came here to a history center, and I think if I talk to the people who helped build this, they'd say, we didn't build a history center so we could think about the old days. We built a history center so we could think about the old days and then move forward with what we know. And so you can think about the history of the survey, the history of the work we did here, and then we have to do something with it. And so that's our next action, is to take the history of the survey, take this new information, and then get busy with it. And so thanks for being here. What a great group. You're outstanding. Evelina, the team, Rainbow, great work. Strategic Planning Group, great work. So thanks. Travel safe, and we'll see you back here to get to work.